Hi, I'm Dr. Melanie Palm from Art of Skin MD in Solana Beach or San Diego, California. And today we're going to talk a little bit about lip filling. It's almost Valentine's Day, and so we thought that was appropriate. You want a kissable pout. And lips are really an artistic venture. You want to make sure that the physician and the board certified dermatologist that you have performing your lip procedure is one that's done a lot about it, that's actually looked at your lips closely, and is really going to complement the architecture of your own lips and not try and change it into Angelina Jolie lips or something that's a little bit undesirable, or that trout pout that oftentimes patients come in and are scared about when we talk about lip augmentation. So we're going to pan over to our wonderful patient Jet and take a look at her lips. We've given her a block because I am sort of a stickler for making sure that patients are really comfortable during the procedure. And we're going to do a couple things to augment her lips. She has really pretty architecture to her lips. You can still see a well-defined border on her lips, and oftentimes we have 5 pillows. So if you part your lips just a little bit for me, Jack, we often have 3 pillows up on the upper lip, and then there's 2 pillows that kind of sit in the middle part of the lower lip. Your upper lip should be about 1/3 the ratio and about 2/3 the ratio in the lower lip. And you want to keep that proportion. You know, your upper lip shouldn't be the same size as your lower lip. Your lower lip should be a little bigger. And over time we can lose a little bit of volume in the corners of the mouth, so we'll probably augment that a little bit. And you can close your lips again if you want to. And something else that happens is, you know, starting around age 30, we start to lose a little bit of volume all over the face. And that includes this white part of our upper lip. So something that we're going to do that's virtually painless and has little to no opportunity to cause bruising or bleeding is to use a cannula technique in which we inject or make a little point insertion here, and we use a blunt shaped tube, so something that's not sharp, in order to restore a little bit of volume in this area. And it's almost like pulling up the curtains. It helps restore the natural architecture to the lip. So we're actually going to do that first, and then we'll actually augment a little bit of Jet's pretty lips so that she has kissable lips. We're good. So on the right side of her, I'm going to make a little entry point, and that's where we're going to do this little cannula insertion. So she's numbed up and she's got a block. So did you feel that at all, Jen?
Mm-mm.
So that's our little entry point. And then this is our cannula tip. So again, this is blunt. So if I were to put my finger on it, it doesn't actually poke me. And we're going to go through that little insertion point. And we're going to start building a little bit underneath our nose. Say we've got a bony platform that sits under our nose, and with time we start to lose a little bit of our bony support, and our nose actually starts falling into our face, which is not a good thing. So what I'm doing right now, my tip is up there, and I'm making slow little strokes, just basically laying down an even playing field across this upper part of the lip. And as we start to do that, it'll help Jet's lips, her upper lip, turn upward a little bit. This also gives you some support. So right now I'm over here. Gives you a little bit of support so you're not forming those little vertical lip lines that we have a tendency to get over time. Still doing well, Jet?
Mm-hmm.
Feeling any of it?
Nothing at all.
Good. And I'm just putting a very small amount. You know, I don't want to do anything to disturb her pretty architecture because she actually has quite beautiful lips, but we just want to enhance the natural beauty that Jet already has. So you can see my cannula, we've worked all the way from up here to down there a little bit. And this is no pain, and the nice thing is we used to have to do this with a sharp needle. Now with this cannula we can do it without a sharp needle and just very little opportunity of bruising. I probably done this now on about 50 patients, and I have yet to cause a significant bruise. So you can see we've done this side and just propped it up just a little bit. So we're going to come over to the other side and do the same thing. So a little poke, Jen.
Mm-hmm.
1, 2, 3. How's that?
Pretty light.
And there's our little entry point. We're going to do more of the same. So we're going to start up underneath the nose, so my tip is right there. Still doing well?
Mm-hmm.
And we're building up that platform underneath the nose. Okay, so we're just continuing the filling on this left side of Jet's lips. And now you can see there's my cannula edge right at what we call her philtral column. So the pretty little area where the Cupid's bow resides on the pink part of the lip. And we're just, again, putting just very small amounts to build up this upper lip. And you can see the effect it has actually in sort of propping up the pink part of the lip, and we haven't even touched that, which is pretty remarkable. And again, this is with no discomfort. You can see that Jet is just sitting pretty. And I'm going to come over and we'll just put a touch more over there. And it looks natural. I think that's one of the biggest concerns when patients come to me and are concerned about lips. They want to do something, but they want it to look natural. They've maybe seen less than aesthetically pleasing results, and you know, that's a major and a valid concern. And so we want to do things to just sort of turn back the hands of time, but not disturb the natural, beautiful proportions that people have in their upper lip. So you can see that was upper lip filling. So we'll come back with you with part 2 where we actually fill the pink part of the lip.